This video is about writing paraprofessionals on the IEP when the child qualifies for third-party billing services. So there are two places on the IEP where we address paraprofessionals when the child qualifies for third-party billing as well. Both of these pieces fall on the services grid page. The first is on the service grid itself. So it's the top box where it's special education related services. You would list all of the services that you typically provide to the child, such as reading or math or social skills, that type of thing. Then you have to add one more service, which hides out just one box lower. It is called the designated coordinator. This used to be called Qualified Developmental Disabilities Professional, and it's recently changed in legislation, and so it's now called Designated Coordinator. We list Designated Coordinator purely to meet the compliance regarding the legislation. The piece that's helpful for you is supervision of paraprofessional. These are the services that you provide when you're talking to the paraprofessional. How's it going? What is the child working on? Where are we struggling? That type of thing. We recommend that you have a minimum of 10 minutes per month of service. However, you certainly will have students where you do need more services, and maybe you even want to list 10 minutes per week or that type of thing. Think about how much time you're talking to the paraprofessional. Again, 10 minutes a month is really the minimum amount. Then this is a service that's provided by you, the special education teacher, and you would list the provider number in the box. Then there's one other place where we will address this service, and that is in the child-specific paraprofessional support. You would select yes, and you select Add Paraprofessional Support, which opens up the box all of the information that you need to complete. You must use the words personal care attendant in this box. Personal care attendant is the medical term, it's the medical assistance term, but it really means the same thing as paraprofessional. The two services are very similar. Then go ahead and complete the amount of service the child receives in the classroom, and complete the boxes just as you would for any other service. In this box is the most confusing part of this. You have to list the same pieces that we talked about when we talked about paraprofessionals, but you have to add two additional sentences. We recommend that one appears at the beginning, and that would be what the child's diagnosis is. Now, don't overthink this. Many times this is fairly easy. Syndrome. Requires support from a paraprofessional. However, many times there isn't a medical diagnosis such as that. We do have other pieces that we provide, such as Johnny has behavior concerns or developmental disabilities. Any of those would qualify as a, quote, diagnosis. Then you would list whatever it is the paraprofessional's job is. Finally, you have to list one additional sentence. To make it easier, I put it in the drop-down. It's the very first sentence at the top. The paraprofessional is supervised by the special education teacher, and the case manager is the responsible party. This sentence must appear any time that a child receives their paraprofessional services and is third-party billable. If you wanted to list these two sentences on all IEPs that indicate that the child has a paraprofessional specific and the child specific, that is absolutely okay if you just want to get in the habit, but it must be for all students that are third-party billable. So the paraprofessional is supervised by the special education teacher. These again are the services that we talked about earlier, where you're just touching base. How's it going? What's Johnny up to? Where is he struggling? And then the case manager is the responsible party. These are the services that already occur, such as if there needs to be a change to an IEP, more service, change in goal, that type of thing. Case manager is responsible for that. It's nothing different than what you're already doing, but it is required that we actually document it in the IEP. So again, these two sentences are different than what we talked about previously. However, That is the only change that you would do different for third-party billing. Uh, and you certainly can include it for other students as well. There are examples in the handouts that were attached. Be sure to refer back to those and ask Shelley Junkemeyer or myself if you have any questions. Thank you for